Hi everyone. Thank you so much for joining and listening to this presentation. My name is Ashley Stoneburner and I am a Senior Research Analyst with the Nurse Family Partnerships National Service Office. Today I am presenting how the pandemic has changed the way Nurse Family Partnership delivers our program and how we have adjusted to meet the needs of our families in these complex times. Today, I will share with you what Nurse Family Partnership does and tell you how our program delivery has changed when the pandemic began in March. I will talk about what happened when our network partners continued to provide services safely and the barriers we have faced. Finally, I will discuss what we are seeing and hearing from our network. Nurse Family Partnership is an evidence-based, voluntary community health program that works to address disparities in health for first-time families who are living in poverty. NFP pairs families with a personal nurse that visits them regularly during their pregnancy and when and through their child is 2 years old. The program comes at no cost to our families. Over 20 years of research, including clinical trials, have shown that NFP impacts maternal health, birth outcomes, and economic self-sufficiencies for the family we serve. Nurse Family Partnership has served over 330,000 families since replication began over 20 years ago. We currently have over 40,000 active clients and over 2,300 nurses across our network. The numbers of currently active clients is shown in the displayed map. NFP is operated in 40 states and the U.S. Virgin Islands and serves clients in 722 counties. Many of our network partners reside in public health departments, while others are within hospitals, health systems, or other community-based organizations. The National Service Office, which is in Denver, Colorado, provides support in the form of nursing consultation, advocacy at a national and state level, data analysis and evaluation, and philanthropy. Our nurses provide education, support, clinical assessments like tracking weight gain, monitoring blood pressure, and child growth. Nurses provide referrals to many services such as housing, childcare, healthcare services, WIC, and others. NFP nurses screen for intimate partner violence, depression, anxiety, and monitor child development. We also support families in setting and achieving their goals. Keeping our nurses and clients we serve safe is always our top priority. In March, the National Service Office began instructing our network partners to begin seeing clients solely via telehealth. Visits using technology has always been an option for NFP nurses since the clinical trials. However, it became incorporated into the model in 2017 when telehealth guidelines were established and nurses were trained to deliver program content using technology. Previously, nurses were instructed to offer telehealth visits as an option to clients who were not in pregnancy or early postpartum phase. However, when the pandemic began, we expanded use to all clients, regardless of their program phase. HRSA released a statement encouraging home visiting programs to utilize telehealth, and the Department of Health and Human Services waived potential penalties for HIPAA violations, all of which reduce barriers to delivering telehealth across our network. This graph shows the percent of completed visits using telehealth by week in 2020. Telehealth includes video conferencing, phone, email, and text. On the y-axis is the percent of all visits, and on the x-axis shown the start of each week in 2020. You will notice the sharp incline in the percent of visits completed using telehealth starting in the middle of March when the national stay-at-home order began. Telehealth visits increased from an average of 5.4% of all completed visits to an average of 94.4% of completed visits and reached as high as 98% in April. As more states began reopening at the beginning of May, you can see the proportion of visits via telehealth dips slightly, but still remains over 90%. Our nurses did a phenomenal job pivoting to telehealth to safely maintain contact with the families we serve. The biggest advantage of telehealth was allowing for a safe way for nurses to maintain contact with high-risk families. Nurses have provided blood pressure cuff and trained pregnant moms to monitor their blood pressure. and baby scales to concerned families so they can track their baby's weight gain. We have heard of many stories from the field of nurses who identified preeclampsia among their pregnant and early postpartum clients or recognized early signs of preterm delivery. In these cases, maintaining contact has literally saved lives. Some other benefits were a decrease in visit cancellations and an overall increase in the average number of visits among clients. Without commuting time, some nurses report having more time to chart and do research to address the needs of their clients. As we made the transition to telehealth, it became obvious that without in-person visits, some clients did not have the ability to connect with their nurses at all. As the pandemic continued, we were alerted that some clients had lost employment and would no longer be able to pay their phone bills. NSO quickly conducted a needs assessment to determine the proportion of families who were in need of a phone or a phone plan. We estimated that almost 10% of our clients were in need. While the rest of this presentation will focus mainly on this immediate barrier to using telehealth, I also want to take 1 minute to discuss other barriers that came up as time went on as we are trying to address across the network. Nurses reported greater difficulty in performing assessments and screening. Telephone calls are difficult with a baby or toddler who requires attention, and therefore many visits with moms are conducted during nap times, making it impossible for nurses to observe the child or parent-child interactions. Privacy issues prevent sensitive screenings from occurring, like mental health and intimate partner violence screenings. Some clients are experiencing technological issues during calls, while many of us are experiencing telehealth fatigue. As time goes on, the importance of in-person visits is obvious as engagement with clients becomes more difficult. Nurse-family partnership clients, many of whom are experiencing unstable economic housing or relationship circumstances, are disproportionately affected by inequities in health and healthcare, and are at a higher rate of poor birth and maternal health outcomes, even in non-pandemic times. As the pandemic has continued, it has become increasingly evident that COVID-19 is having a desperate impact on the marginalized families and communities, exacerbating these existing inequalities. In this time of crisis, the connection between a first-time mother and her NFP nurse and other healthcare providers is more critical than ever. We found an innovative solution to ensure that every mom in our program had access to critical technology, including smartphones and data plans, so that we can continue to provide our services via telehealth during this time of stress and uncertainty. And so to ensure that all clients had access to a phone and phone plan, the Phones for Family initiative was born. NSO teamed up with Verizon and AT&T, a logistics company, to distribute over 3,100 iPhones across 217 sites in 40 states. We offered 4 months of unlimited service and data to recipients. Most phones were sent to agency staff to distribute. However, we also offered an option for phones to be sent directly to clients when drop-offs were not possible, in places like New York City at the height of the pandemic. The Phones for Family initiative was offered to our local network partners for a total of 17 weeks. We ended distribution of phones August 1st with continued service of phone plans through the end of this month. The iPhones are for the clients to keep, even after the program ends. This chart shows the average number of visits per client between May and August by Phones for Families participation. Phones for Families participant had on average 1 more completed visit compared to non-participants in the month after the pandemic began. This was a significant difference. This chart shows the percent of completed visits by Phones for Families participation between May through August 2020. The recipients of phones were able to complete visits with their nurses at the same rate as non-participants. This was really good news for us. We received some great feedback from our nurses about the opportunities the Phones for Families initiative had provided, and I'll just read some for you. It has been helping them a lot to connect with resources and emotional support with others. The phones that have been distributed to clients have been a tremendous help. Several of my clients have been able to engage with NFP because of the NFP cell phone that they received. The iPhone has been extraordinarily helpful. I have a few clients who would have been impossible to reach without this service. And a couple more. The best support we can receive is ensuring our clients have the technology to communicate with us, and we have the technology to communicate with them. The Phones for Families program was very good for us. The client phones have really helped. I have only needed them for 2 at-risk clients, but it made such a difference in their pregnancy journey. The phones help so much. Thank you for donating to many of my clients. Giving the clients the access to the phone was a major game changer for a lot of our clients being able to connect to their nurse. We are also tracking how clients are feeling about our program delivery using telehealth. In a small sample of clients who have responded to our client satisfaction survey pilot, we asked clients how much they agree to the following question. Overall, I am satisfied with using telehealth to complete visits with my nurse. The bars indicate the percent of clients who agree and strongly disagree with the statement, displayed here by program time point. Overall, 84% of clients were satisfied with using telehealth to meet with their nurses. Variation does exist among program time point, with the highest levels of satisfaction among our graduates or those who are currently pregnant. Another question we asked was how much clients agree with the statement. Telehealth visits are as good as face-to-face. Again, the bars indicate the percent of respondents who agree or strongly agree with the statements. We see the overall 76% of clients agree that telehealth visits are as good as face-to-face visits. Again, graduates and pregnant clients have the highest levels of agreement, while our postpartum clients may be missing in-person interactions with their nurses. The National Service Office will continue to track the outcomes of this initiative. We may look at retention, satisfaction, and program utilization among Phones for Families recipients. Our hope is to continue this program into fiscal year 2021, and we are currently obtaining approval of this vital service from our board. We'll also continue to track clients and nurse satisfaction with telehealth. We'll hope to find new ways to offer support to the field, and above all, we will monitor COVID-19 on a national level to ensure that in-person visits are safe before we return to clients' homes. Once again, thank you so much for tuning in to this presentation. If you have any questions about Nurse-Family Partnership, our transition to telehealth, or the Phones for Family initiative, please contact me at my email address shown here, ashleystonebrenner@nursefamilypartnership.org. Thank you all. Have a great day.